So, Dr. Khan, what other health complications should a patient with this organ or tissue should worry about?
After the transplant of the organ into the bodies, there are possibilities of getting infections, and there's also a possibility of rejection to the organ that was transplanted into them, especially since it's two completely different types of tissues, a pig tissue and a human tissue. So the best way we can avoid that case is to try to trick the organ into thinking that it's a human tissue as well. And as for infections, we just try to use the immune system, and we also use drugs that can fight against infections.
That sounds good. So, are you worried about the instrumental use of animals, like pigs?
In my opinion, no, because we have many cultures where, yes, we respect animals, and in some cultures don't even eat pork or pig or any sorts of animals food. But we also have a culture where people do eat animals, pigs, so I figured, why not?
Okay. So people have like pig farms anyway, so we can, instead of just throwing those organs away, they can be used.
Yes, it's basically being resourceful.
Okay. So, Dr. Khan, when a person donates an organ to, like, someone who needs it, they usually have like a little organ donor relationship, and that is missing with the animals because they know that they just killed the pig. And
I wouldn't say there's really a relationship. Well, one thing, there's the language thing. You can't really talk to the pig. Mm-hmm. And two, if it's a heart donation, there's obviously no relationship with that because the pig will be obviously terminated.
And it might reduce the trauma
of course, it would definitely reduce the trauma for the patients. And especially psychologically, yes, because after receiving such transplant, I think the best thing to focus on for the patient is to recover from the operation and then get his feet or her feet back on into life.
Okay. So, the patient with the organ, do they have any loss of identity, or since they have organ that belongs to animal, do they have anything that behavior that may seem like
it hasn't been quite defined yet,
okay.
Because we have to watch. Mm-hmm. That's another case, like monitoring the patients, because we have to watch the patient's behavior, reaction before and after receiving the transplant, to see if there's been any side effects or change in behavior. And there's been some cases, but not wild cases where they change dramatically. Just a mild side effect, basically. And as for the lifelong monitoring, that's another issue we have because some patients, they don't want to have anything to do with after the surgery, and they just want to return to normal. But we have to see if this xenotransplantation is really working in a short-term possibility or a long-term possibility to see if it's working at all perfectly. There's also the case where we have to watch if the patient is spreading infections to the community outside itself. So yes, like monitoring on the patient is a requirement after the transplant.
Now here's a message from Dr. Valdez discussing about his legislation that he had while he was trying to publish his works on xenotransplantation.
Should we be afraid of putting living animal cells into humans? Scientists have worried about the danger of a virus in pigs called PERV. It stands for Pig Endogenous Retrovirus. It sits in the chromosomes of the pig and doesn't do the animal any harm. But what could it do in humans? Could the virus infect a patient and eventually unleash a whole new disease on mankind? After all, scientists believe AIDS came from monkeys and that SARS may have been passed from civet cats to humans. But at the London, Ontario lab, Dr. David White dismisses this fear as theoretical and unfounded.
How do I know it's a small risk? Well, I know because humans and pigs have been in close association for millennia. If you think of veterinary surgeons and slaughtermen that have cut themselves and contaminated them with pigs, we've never seen an infection with PERV.
The risk may be small, but in Mexico, the doctors are rigorously testing for any sign of PERV in the teenage patients. And Dr. Valdez says the Mexicans are also testing the blood of close family members.
We have developed the technique to test the PERV here in our patients, in the parents, and in the people who lives with the patients, in order to, to keep the international community
Happy.
Yes.
Okay, so you're testing everyone for presence of these pig viruses.
Uh-huh.
Right, you haven't seen anything.
No.
The Canadian scientist who taught Dr. Valdez how to work with pig pancreas and testicle cells believes that pigs may well be the future for diabetes, but not yet, for both ethical and practical reasons.
Ethically speaking, myself, I could not do this now with the techniques that I have. Even if tomorrow the government said we can go ahead and do these transplants, I would not do it, because I know in my hands it would not work.
Dr. Corbett doesn't believe he could get the animal cells to work, and he's not convinced the transplants are working in the hands of the Mexican team.
Why is the scientific community skeptical, such as myself? A milestone in research is to publish your data. This has not been published.
Scientists need to present and publish their data before anyone will believe them. Dr. Valdez says it's not that he's afraid to publish, it's that several medical journals have rejected his work. So they wouldn't publish it because
Yes.
of the ethical questions?
Yes.
Mm-hmm. So you sent it to people and they rejected
yeah, sure.
it. How many journals did you send the first
3.
one?
Important, very important.
And they all said no.
Mm-hmm.
And how did you feel when they all said no?
Really mad.
Because?
Because they were taking out the possibility to another community to learn something.
Dr. Valdez is clearly frustrated. He insists he has nothing to hide, and he wants to share what he's learned with the rest of the world. He and his Canadian collaborator believe much of the criticism is ill-informed.
You know, I'm pretty disturbed by this, actually. When I agreed to collaborate with Raphael, my boss at the Robarts here said, "Is this ethically approved?" I looked at and got copies of all the ethical documentation. Raphael has gone through all the correct steps. There is a law in Mexico which governs xenotransplantation.
We are not breaking any rules at all. With research here in Mexico, we are very strict. Very, very strict.
Okay, well that's it for our show. Thanks for joining us. Thanks for being here, Dr. Khan.
Thank you.
It's really nice to have you here.
Thanks for inviting me.
And now, everybody go out and have a nice Friday. Bye.
Bye.